It often starts quietly. A little brain fog you brush off, a weird numbness in your feet, you trip while walking down the hall, your hands don't feel quite right. The doctor says it may be neurological, maybe even an early multiple sclerosis. But what if the real problem isn't your nerves? What if it's something far more treatable and almost always missed? A simple trace mineral deficiency that could be silently disrupting your nervous system, your immune health, and even your energy. That mineral is copper. And today we're going to talk about how its absence can mimic serious disease, why it's often overlooked, and how to know if it's happening to you. But first, welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. Today, we're diving deep into copper, why your body needs it, what happens when you don't have enough, and why your gut health may be more involved than you think. So what is copper, first of all, and why do we need it? Copper may be needed in tiny amounts, but it plays a massive role in your health. It helps your body absorb iron and make red blood cells. How? Copper helps move iron where it needs to go in your body. To simplify it, without it, iron can get stuck in storage and never make it into your red blood cells. So even if you're taking iron supplements, you might still feel tired and anemic. Next benefit of copper is that it powers your mitochondria, the energy factories in your cells. Without enough copper, your energy production slows down, which can leave you feeling drained and fatigued. The next benefit is that copper supports your immune system. It helps your white blood cells respond to infections and supports enzymes that protect your body from free radicals and inflammation. So when copper is low, your immune defenses can actually weaken, making you more likely to get sick and unfortunately slower to recover. And finally, copper plays a vital role in brain development and nervous system health because it helps produce neurotransmitters, the chemicals that carry signals between brain cells. It also supports the formation of myelin, the protective coating around your nerves. Without enough copper, these signals slow down or get disrupted, which can lead to symptoms like numbness, tingling, poor balance, memory problems, and that frustrating brain fog that makes it hard to focus or think clearly. So, to summarize all of this, when copper levels drop, you can feel it sometimes in ways you'd never connect. That's the interesting point. The next section is what causes copper deficiency. Let's first look at the most common culprit, that is zinc overload. Zinc is great for immune support, but too much of it, not so great for copper. Zinc and copper use the same absorption pathways in your gut. If you're taking high doses of zinc for long periods, like during cold and flu season, zinc crowds out copper. It's like traffic on a one-lane road. Zinc speeds through and the copper gets stuck at the light. And this is one of the most common causes we see in patients who are unknowingly creating imbalance through self-supplementing with zinc. The next reason for copper deficiency is malabsorption syndromes. Copper is absorbed in the small intestine and mainly in the duodenum and upper jejunum. So if you have gut conditions like celiac disease, Crohn's disease, ulcerative colitis, or you've had a gastric bypass, your gut lining may be too inflamed or damaged to absorb nutrients properly. Even with a perfect diet, your body may not be getting what it needs. Copper is one of the first nutrients to go, actually, when malabsorption is at play. So it also comes into play when we discuss leaky gut, and we'll discuss that in a minute. But the next common reason for copper deficiency is low stomach acid or acid-suppressing meds. Many of you are familiar or probably are taking proton pump inhibitors like omeprazole or pantoprazole. These reduce stomach acid, and while that may help with heartburn, but it hurts your mineral absorption. Copper needs an acidic environment to be ionized and absorbed properly. Without enough acid, the copper just passes right through. So on a related note, as promised, a very common cause of copper deficiency that we see at our functional clinic is leaky gut. When the gut lining becomes inflamed and permeable, your ability to absorb nutrients, especially trace minerals like copper, goes downhill. You may be eating well, but chronic inflammation, low stomach acid, and disrupted gut microbiome can silently sabotage absorption. So, if you've been dealing with GI issues, food sensitivities, or unexplained fatigue, copper deficiency may be part of this big picture. And lastly, I would like to mention genetic disorders. Those are genetic disorders related to copper deficiency. And one, the most kind of known one, is Menkes disease. It's a condition where the body can't transport copper properly. So even if there is enough copper in the diet, it doesn't reach the cells that need it. Menkes disease usually shows up in infancy with symptoms like weak muscle tone, seizures, poor growth, and unusual hair texture. While it's rare, it reminds us how tightly copper is regulated in the body and how devastating things get when the balance is lost. So, what are the symptoms to watch for? Copper deficiency doesn't always shout, it whispers. The symptoms are often vague and easy to misdiagnose. Look out for fatigue, frequent infections, pale skin or anemia that doesn't respond to iron, numbness or tingling in your hands and feet, unsteady gait or difficulty walking, premature graying of hair, brain fog, or memory loss, memory issues. These symptoms don't necessarily happen together. One person with copper deficiency can have brain fog as their main symptom, and somebody else can have fatigue and frequent colds as their main symptoms. Also, the degree of copper deficiency matters. So, if you were nodding your head right now as I was listing the symptoms, and especially if you also have gut issues, it may be worth testing your copper levels. That brings us to the next section, how to test and treat copper deficiency. Testing is relatively simple. Ask your provider for a serum copper test and ceruloplasmin level. Ceruloplasmin is actually a protein that carries copper in your blood. There are also functional nutritional labs that are very precise, and we use them a lot at our clinic, where copper level is measured inside of the cell. So it's a cellular level, not the serum level. So what to do if your levels are low? If your levels are low, cut back on excess zinc. Address gut inflammation or nutrient malabsorption, and if needed, supplement copper carefully and always under medical guidance. Before or while considering supplementation, try foods naturally rich in copper, such as organ meats, especially beef liver, one of the best sources that most people don't like, unfortunately, shellfish, oysters, crab, lobster, nuts and seeds, especially cashews, almonds, sunflower seeds, and sesame. Dark chocolate, yes, a square of dark chocolate can help. Legumes such as lentils, chickpeas, and black beans. Whole grains like oats, quinoa, and buckwheat. Leafy greens, especially spinach and kale, mushroom, especially shiitake mushroom, and avocados. They contain a modest amount of copper plus other healthy fats. Remember, on the other side of the spectrum, too much copper can be toxic, so don't guess. Test first. In conclusion, copper deficiency is sneaky, underdiagnosed, and often confused with other conditions. But once you understand its role, how your gut health, supplements, and even medications can affect it, you can take real steps towards feeling better. I'm looking forward to hearing from you in your comments. Thank you so much for watching. Until next time, bye-bye.